I felt empowered. I was made to understand that, yes, I'm a doctor, just that I'm not licensed to practice in the UK yet.
It takes time to build someone's confidence. I gained a lot of confidence through the program.
I call my team as a home. Everybody knows me and I know my team also. It's really nice.
This video captures a discussion between medical support workers and programme leaders at the North Middlesex University Hospital. They're kindly sharing their experiences of setting up a training, learning and development programme for medical support workers built on inclusion and equity. During the discussion, colleagues share good practice, what went well and why, and lessons learnt. Other NHS organisations looking to start a medical support worker programme and recruit can use this to develop their own programme or enhance an existing one. This video highlights what can be achieved when hospitals are creative, try something that hasn't been done before and apply the same principles as they would for research. To put the Trust's success into numbers, the team has facilitated over 85 medical support workers. Out of those, 63 have passed pre-registration assessments and fully registered with the GMC, a much higher average than the wider NHS. 33 have taken up clinical roles at the hospital. 96% of medical support workers feel that the support they received through the Comprehensive Educational Support Programme has enhanced their well-being.
So great to be back at North Middlesex and fantastic to have heard about the medical support worker programme. Love to understand everyone's experience of the programme.
I think I would say initially we were introduced to the programme right in the middle of COVID. And, it was a matter of the central team and NHS England give us a list of IMGs that were in London, nearby the hospital, and they suggested that we phone them up and ask them would they like to come and work.
The medical support worker role is one of service provision and involves taking histories, discharge summaries, cannulation, ECG, audits, and depending on the clinical expertise and specialisation of the individual, assisting with more specialised tasks.
My name is Jackie Dudley. I'm the Assistant Director of Medical Education and Development at the North Middlesex Hospital. I manage the medical education team, so that's the administration side of the project.
We designed an induction. It was very much about clinical skills initially, and we did the training. And then once the medical support workers hit the wards, we were speaking to the consultants and we were looking after them and they were giving us feedback. We were listening to the feedback and did what was needed on the ground very, very rapidly. And then the programme just took legs because it was so successful. NHS England gave us money again and we brought another cohort in. But we were prepared this time. We had the template. We really did know what we were doing.
We've very much been able to not just deal with the educational needs from the medical support for the medical support workers, but also their pastoral care needs, their social needs, and we see them not just as a learner, but as a whole person.
My name is Alice Mann. I'm the Director of Medical Education for the North Middlesex Hospital. We gave autonomy to the MSWs, appointing their own lead, so they organised their own induction and onboarding. They've organised their own support for learning for the exams, and how they mentor each other and buddy up.
My name is Chukunonso Jack Okirike. Most people call me Jack. I'm the team lead / program manager for the medical support worker program. Back home where I'm from, Nigeria, if you say to someone, "Are you all right?" it more or less saying to you, "Are you sure you're okay mentally?" So you can imagine the shock coming into the NHS, and right from the door, everyone says to you, "Are you all right? Are you all right?" These are one of the few things that we kind of incorporate in the induction program and workshop that we organize for medical support workers, trying to make them understand the nuances, not just of the NHS, but the culture, the language.
I can now speak confidently, understand the language really well, understand different accents here. Because when I initially came in here, I felt like I was having difficulty understanding the accent. So it's like learning those little things that adds up, and then you just oh, I now understand British language. I am supervised by a consultant and a registrar whom I can easily ask questions to and make helped me on decision making in terms of the medical side of things. Obviously, we're there to learn as a junior, not to make decisions on our own. So it's kind of like you're in a safe place. You're doing work, but at the same time at a safe level, being guided by the experts.
Being in the NHS and working with the patients and learning the culture was, for me, should I say, it was more like a golden tool that I wouldn't have gotten anywhere else. It helped me really to understand better. When I read for the PLAB exams, it helped me to understand the PLAB 2 process, which was basically the clinical process of the exam. It entailed like meeting a patient, asking questions, because it was something I was already doing.
That's something that almost everyone says. Had it not been for the medical support worker program, I don't think I would have made it through my exams. The medical support workers joined the program all from different experiences, different backgrounds, different cultures, and also different clinical stages. And so being able to have bespoke support for each individual, taking into cognizance their peculiar circumstances, and structuring that in a way that they have support right from the time of onboarding to when they get placed in the clinical department or clinical unit, up to the point where they are done with their exams, go through registration, and probably are interviewing for jobs. But one thing we'll try to do, like Hilary and Jackie and myself, is routine appraisals. So we don't just look at how are you doing with the exams. We look at how are you doing in your clinical team. How are you improving with your communication and things like that. So that's where I come in. I get to have one-on-one meetings and find out what are the challenges you're having, what are the difficulties you're having, how best do you think it can be helped. One thing we also do is, for the new medical support workers, we body them up with older medical support workers. So when they talked about shadowing, it's more or less working with an older medical support worker, shadowing what they're doing, getting to know what the routines are like, and then after that they get to work alone. And they in turn do the same for other medical support workers that join the program. So it's been a seamless transition from the very first set to the last set of medical support workers we've had.
Have you had any challenges with, in terms of relationships between junior doctor colleagues and the MSW team?
Initially, the junior doctors weren't quite sure how to relate at the onset, but when they saw that these international medical graduates were quite competent and not inferior in any way, they obviously absorbed them and welcomed them into the team.
Whenever we had medical support workers who, if you like, stepping up but working safely and within, their scope of practice. I remember we had a quality day and Jack presented the medical support worker program, and one of our non-executive directors sort of put his hand up and said, I'm overwhelmed. I was walking around the ward and I was watching the medical support workers with their badge on, clearly medical support workers, but how they were behaving, how they were conducting themselves. They were so incredibly professional. He was very proud to be part of the North Middlesex Hospital because he could see something, the reality of it in practice. And then very quickly, of course, these doctors then were able to attend an interview, give real examples of what it's like to work in practice, and got the job.
The moment you accept the fact that these are medical graduates and accord them that respect and the opportunity, you stand to benefit in so many ways, okay? So it's the perception. So have the right perception.
I thought that was so powerful. Imagine that you are a doctor, behave as if you are a doctor, to feel that you're a doctor. And in a way, that's why we wanted to make this video, because we had the sense that there was something happening here that was making people feel empowered and feel good about themselves. And
part of the job description says you don't introduce yourself as a doctor, you just say your first name because you're not working as a doctor. But when I work with my consultants and we have the ward rounds together, they'll introduce themselves and then introduce me as, this is Dr. Mara. She's working as a medical support worker, working towards her GMC registration. That made me feel like part of the managing team. That gave the patients confidence in me. When I go to take their bloods or carry out any procedures on them, they feel that, yes, this is a trained doctor in a process of registration coming to treat them.
The leadership team all bring with them different areas of expertise. Dr. Chukwunonso Jakokirike is the team lead and programme manager. Jackie Dudley is the operational manager. And Dr. Hilary Tyndall is the clinical lead.
I'm Hilary Tyndall. I'm a consultant physician at North Middlesex Hospital. I love education and I love teaching and training. I had been previously our training programme director. So I had experience of education and I obviously know a lot of colleagues in the hospital.
The strengths that the three of us have. So Hilary has a very senior consultant, education background. Jack, as an IMG himself. We all bring different skills, but I think the three of us have worked very well. I think sort of my strength would be as an operational manager. I have got links with the finance team, the HR team. That sort of human resource element, it doesn't frighten me. So I suppose we're able to, make decisions swiftly.
And senior leaders in the trust have let us develop the programme. They obviously look at it from time to time, but they have never said no. And that, I think, is they're always open to suggestions and, okay, you want to do it this way, fine, let's try it.
Knowing that, Jack and Hilary and Jackie work so well together and that their plans are always, well thought out. And so it's today, I've met some people that I haven't met before, but I'm always hearing about what they're doing. So it's really nice to have this round table discussion. Because they had their own lead, they were able to organise what they needed. And so Jack has been the one who's organised teaching, the kinds of support that they needed. The support that Jack gives to his medical support worker colleagues is sort of like being a supportive friend and colleague, rather than if it were a consultant lead only, that, sometimes you perceive that feedback or support as sort of a critical parent, and knowing that that person hasn't lived through what you're going through, sometimes it can be harder to take on that kind of feedback. So I think, the successes that we've had really have been, the leadership that Jack has shown and how he interacts with all the other support, medical support workers.
From the beginning, when I had any kind of a question, shall I do that, or how shall I move on with like this, they always there to help me, always there to support me. And even I need to admit that in first my time, I actually lost in this hospital. I couldn't find my, and they even didn't, say me anything and help me with this one.
There's no way you can lead without giving the people you lead a voice. And you won't hear from anyone if they're not comfortable knowing that whatever they say to you is not going to be looked at in a funny way. And one thing I say to them when they have the clinical induction workshop and orientation is, if you have any doubts, ask. Okay, you don't lose anything. You only get to either affirm what your suspicions were, or you get new information.
So there's the mental support, there's the financial support, there's the clinical support, academic support. It's just a comprehensive program that has really helped the IMGs.
I know that you are a surgeon and you probably go into higher surgical training. When you leave this role, what are the plans to replace Jack?
Well, that's what Jackie and Alice do.
Yes. I think the ambition is it will become part of the normal business planning cycle for each trust. It would also be my wish that it would become part of the education contract and become a legitimate route into the NHS for IMGs. And I think having the governance around it as a training position would be really, really helpful.
So that there's always a position like Jack's as it provides.
I think it would definitely need to be, yes, definitely. Yeah.
Let's look more closely at the medical support worker role from the perspective of medical support workers past and present.
I benefited a lot from the program with regards to the exposure, the support I got. But looking at it from the benefits of the NHS point of view, I think it was also very useful. There are some times that the doctors were severely short-staffed, and my presence was a huge help for them to get through the day.
My job actually requires me to starting around 9 a.m. I'm getting to my ward, starting first checking with my team, and we are kind of listing which patients we are going to see. We are starting the ward run together. I'm usually shadowing them. I'm helping them also.
If there are procedures to be carried out like cannulation, phlebotomy, or the little bedside procedures, I'll be asked to do it, and maybe order some investigations like blood tests.
You know, they say when you don't use your knowledge, you lose it. So this is a very program for you to be on while preparing for the exams. It's very flexible. It helps you to understand what the system is, and it will help the medical graduates to pass the exams really quickly, because there are clinical scenarios which you will only encounter in the hospital, and it will be very difficult to understand them from the books.
The misconception usually is that if you write the PLAB exam to get registered, you're bound to work as a foundation year 2 doctor, but that's not quite true. If you do have experience from your home country, there's the opportunity to work at a higher level, and the medical support worker program in a way kind of validates that experience you have from your home country. We've had a good number go straight into training, specialty training from the time of registration, and yeah, we did have 1 or 2 who were quite senior when they joined the program, and they were able to get into specialty grade, working as specialty doctors, and another working as a locum consultant.
I'd love to put you on the spot a bit, and if you were advising another trust about implementing an MSW program from scratch, could you each give 1 or 2 top tips that you would like to say to this other trust that's about to adopt the program to make it successful, and not just about capacity and service provision?
Give some time to the candidates to actually get a better knowledge for the environment, also for the system. Because, for every hospital, I guess it has different kind of systems.
All the other teams should recognize and acknowledge it as a proper program, and everyone on the team should have a proper knowledge on what the role is or how we can help the team. And I think by knowing, then you understand how we can be of help.
I felt empowered. I felt I was part of the managing team. I didn't feel like some other person that can just go and do bloods or do cannulas. If you can empower the medical support workers, you stand to gain a lot from them.
Go to healthcareers.nhs.uk and type medical support worker into the search bar for more information on the medical support worker role.